Hi, this is Kamna from Kamna Live, and with me today I have Jennifer Bires, and we're going to talk about sexual wellness in the context of cancer patients. So, first of all, Jennifer, I want to say thank you for being here. And for me, as somebody who is in the sexual wealth and wellness space, and also someone who has been seeing just anecdotally the tremendous rise in the incidences of cancer in my own community, in my own friend circle, I got to tell you, three of my closest friends are already cancer survivors, and I see this rising and it's breaking my heart. So of course, putting these two worlds together, when we were introduced by a common friend, I completely jumped on it. So thank you so much for being here.
Sure, yeah. This is a topic that's so important, so I'm delighted to be here and talk about it.
So tell us what you do, introduce yourself, and tell us what you do and how the sexual wellness piece fits in.
Yeah. So I'm an oncology social worker by background. I've worked predominantly in psychosocial oncology support my entire career, but I'm also a certified sex therapist. I found working with patients and caregivers that sexual health was often, if not always, impacted by a cancer diagnosis or treatment, and that there were really not enough resources and not enough people to talk about the issue with. And so I started studying and learning, and now, it's just an area that I like to think about a lot and work with patients in to help improve their outcomes.
It is so critically important, and I'm embarrassed to say that it had never occurred to me until I met our common friend, who brought it up. And then I started thinking about how anecdotally I'd been thinking about, of course, well, your hormones take a major beating, and we're talking about specific types of cancers, obviously. And and if you're a
Sure.
woman and you have breast cancer and you have your breast removed, what does that what does that do to your mindset and your
Yeah.
feminine identity, all of those things? Why do you think it is not talked about or very rarely talked about in the context of cancer treatment and recovery?
I think historically, there was this thought that people should just be grateful to be alive, that it really was a focus on curing the cancer at really any cost. And once that was done, that was kind of the medical system's job. They'd done it and they moved on. I think that is changing significantly. We're paying attention to so much more, like the impact on the whole person, their emotional well-being, their social well-being, their physical well-being. But there's still a lot of stigma around sex and sexual health. And I think that providers are worried to bring it up because either they think they may not have the information or they're worried about offending a patient.
Mm.
When the provider doesn't bring it up, the patient thinks like, oh, this must not happen to everyone. It's just me. I'm weird. Or I don't want to make my doctor feel uncomfortable, so I'm not going to bring it up. And then that brings in a lot of shame around how they're being impacted.
Mm.
Um, and really, when we think about sex, it's so multidimensional. It's never one thing. And I think because it's so multidimensional, it makes it really complex. And it makes it hard for people to think about where to bring it up, how to bring it up, and where to even start.
I think that's a great point, and that's what you and I have discussed earlier in my work in sexuality. We talk about sex being just one part of the pizza pie, right? It's about sexual identity, it's about feeling, it's about desire, it's about how you stand in the world. So how can such a major life change not impact your
Yeah,
sexual
of course.
identity?
Of course.
And it's a really interesting point about be happy just to be alive. I can absolutely see that being the pervasive mindset. So let's get a little specific. Which cancers are we, do you talk about most in the context of this? Which ones are the most impacted? And those might be two different questions.
I mean, I think that um, oftentimes we think that like, oh, breast or gynecological cancer or a prostate cancer is going to be more likely to impact the sexual health of a person. But really, when we think about cancer, it's all of the cancers. So just hearing the words "you have cancer" changes how you relate to your body, changes how you may relate to your partner or partners, changes how you may present yourself when looking for someone to be sexual with. And so I wouldn't say that there's a specific cancer that impacts more than others, although, certainly our sex organ cancers are going to have a bigger physical impact. But really, this idea of how important is sex to the person? What are the things that turn them on? And do they still have access to those? How experienced are they communicating about their own sex or how they can show up in a sexual situation with themselves or with partners? So, really, it's such an individual thing, but there's literature out there that says 40 to 100% of patients will have their sexual health impacted by a cancer diagnosis. And I would say everyone is going to have it impacted, but
Mm,
how distressing it is to them
mm.
and whether or not they want to do something about it is really the question. And how much is it a physical or an emotional impact, or really that multidimensional piece that we were talking about?
The thing that comes to mind for me is, I study sexual shame, is also the idea that, after a certain age, sex shouldn't be important to you. And if you're, and who knows what that age is, right? It keeps shifting. But if you're in your 40s, 50s, 60s, and you hear those words, or even if you've worked through all the regular treatments, I can imagine that that would be a factor as well.
Yeah, yeah. And like, who are you to bring it up? Or what if your provider is like much younger than you or much older than you? And so all of that plays into it. But, I have sat with 80-year-old patients who their sexual health was one of the most important pieces of feeling alive. We talked about earlier that idea of you should be lucky to be alive, but what does it mean to be alive? And for a lot of people, sexual pleasure, feeling good in their body is being alive. And so really there is no age. And also, I always like to say that sex doesn't need to look a certain way or have a certain outcome. We often think that sex is, some type of penetration and that it has to end
Mm.
in orgasm. And those are old ideas that we need to get rid of, just like the idea that you are only going to be sexual in your youth, whatever youth is.
Exactly. No, absolutely. And I'm so glad you brought that up, because that is something that, those of us in the sexual wellness world, we are trying to break down those barriers across, even outside of the context of people that were ill. And, it's really interesting. I read a study that, assuming you get the right care and the right conversations going, that in terms of sexual satisfaction, people who have cancer are no different from people who haven't had cancer. I think the study was cancer, diabetes, and some form of arthritis or something. But the idea was that people who are unwell, who have been unwell, are
Yeah.
still capable of sort of getting back in the saddle, if you will, to use a
Yes.
um, people who are not.
And for some people that sex life can be much more satisfying because instead of doing things the way that they've always done them, they have a real opportunity to rewrite their script. They have a real opportunity, and not even an opportunity, like they're forced to be flexible. They're forced to try things differently. And I think for some people, that for all people, that brings a lot of grief. I mean, a lot of sex therapy is grief work, grieving how things were before, grieving that there's been a change. And it's really important to do that work. So I don't want to sound like this is something simple, just try something new. But
Yeah.
really, this idea of really grieving what was and then thinking about what could be. How could I think about this differently? How could I connect with myself or my partner or partners differently in a way that can still bring a lot of joy, passion, sensualness to the experience. And when those shifts can be made, oftentimes I'll hear from patients that their sex life is more satisfying, it's more fun. And I mean, I think that's what we all want, something that's fun and satisfying.
Sure.
And that may take thinking about things differently than you've had to in the past.
I mean, in the spirit of making lemonade out of lemons, right? This might be this might be
Yeah.
an opportunity. And I completely hear you. It is not easy. And the first step is sort of acknowledging that you want this for yourself. And that is overcoming shame, that's overcoming stories, sexual scripts that don't serve you anymore. And frankly, if you've had a cancer diagnosis, I mean, fuck, you of all people deserve, pardon my French, you of all people deserve to do it differently and do it better if
Yes.
you can.
Yeah.
So
Agreed.
tell me a little bit about what you see. Like, you mentioned prostate cancer. You mentioned some of the gynecological ones. What are the typical things that are affected? And then what are some of the fixes or the treatments that you use to help overcome them? I hate using that word fix. I apologize for that.
Sure. No, I mean, I think anytime someone has pelvic floor radiation, they're going to have a lot of physical symptoms. A lot of medications for breast cancer or gynecological cancers are going to send people into early and immediate menopause. Um, so those certainly have major physical impacts. The way the like sensations may feel different, the vaginal walls are going to be drier, more friable. Um, uh, People may have difficulty getting an erection if they have had some type of treatment for prostate cancer. And so there are physical issues that come up, and those I really like to take one by one. But for a lot of people, it's going to be a referral to a pelvic floor therapist.
Okay.
And it's really learning how to rebuild some of those muscles,
Mhm.
um, and creating space where there may not be as much space as there was before. So dilator usage. For men, it may be using a vacuum erection device along with some of the other medications that are available. So we want to like get a really good idea of what are the physical issues, what are the fixes that exist for them, whether they're medical or pharmacological in nature, getting the patients connected to those. And then once that's been taken care of by either sexual medicine specialists, endocrinologists, pelvic floor specialists, then the work that really needs to happen is how do you, as a person, get
Wow.
used to these changes? How do you communicate about what you need to do to be sexual? Because it's going to look different. I think for a lot of folks, I hear it takes so much more work. Like I have to moisturize and I have to use a dilator and I have to get in the mood early in the morning to prep for the evening. So it can't be as spontaneous as it used to be. And so, really learning how to navigate that, incorporate some tips and tricks into doing that,
Mhm.
can be a really important part of getting better or getting to something that feels good and feels exciting.
Mhm.
Uh, Another thing I really recommend is for people to learn what's pleasurable to them. When we think about cancer diagnosis and all the treatment that goes along with it, they have a new body. So for folks who masturbation is something that's available to them, learning what feels good. So maybe your breast was a really sensitive area and you don't have a breast anymore. And so maybe you're seeing if the inside of your arm is sensitive,
Mm.
or maybe your big toe has a bunch of sensitivity that it didn't have before. But some of these things there's a lot of pressure to figure that out with a partner. And so
Mm.
I really recommend that people figure out how their bodies work and if they can figure out what feels good without the pressure of someone else. And then it moves into, like, do you want to involve someone else? And what would that look like? And what would the communication about that be?
You make so many great points, and this very much resonates with the way I coach and the way I teach people. Is it really it's an inside job. Sexuality is an inside job. So once you start there, then the rest of the world is your oyster. What about tools and toys? You mentioned some of them, but it seems like there's a great opportunity here for certain devices, many types of
Yeah.
devices.
Yeah. I mean, I think a lot of people need more stimulation. So certainly playing with different types of vibration, lubrication is incredibly important. And so finding a lubricant that works well and works for the activity can be really important.
Mm.
Um, Sexy lingerie can be important. So if you want
Mhm.
to cover certain parts of your body, um,
That's true.
or like with some cancers, especially with head and neck cancer, people, there may be smells associated with the cancer. So you may want to think about how you can utilize different perfumes or open air or create something
Mhm.
that feels really comfortable for a patient and their partner. Same with people who have had to have colostomies. I mean, it would be easy to say like, oh, there's this one tool or there's this one thing that folks can use, but it's really, I'm just like thinking the O nut is a good tool. there are a lot of tools that are out there, and it's so individual to think about what is going to work for this person in this situation, and knowing that what works today may not work tomorrow, and that what didn't work today may work tomorrow. And so being really, really willing to be inventive. But there haven't been a ton of newer interventions or newer tech tools in this space. So I think there's a lot of room for thinking about what are some of the tools that folks need that would make this easier and better and more accessible.
Well, they say, what is it? Necessity is the mother of invention.
Yes.
And
Yeah.
I hate to put it this way, but given the rise in cancer diagnoses, maybe we will see. I mean, you and I have shared that I'm very much part of the sex tech community here in the global context. And I think it's just a lack of awareness. I think it's that shame piece that we touched upon, where patients don't want to ask about it and health providers don't want to bring it up. But more conversations like this, I hope, will help to bridge those gaps and make these conversations more open, because it does seem to me that two elements that are important here is making the time
Hmm.
and finding the motivation. And I remember reading a study that really stuck with me, and it was more in the context of age, but it was people after a certain age who enjoy a fulfilled sexual life are those who believe they deserve it, right?
And
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 that's
that's
that
why that
dimension of
therapy piece can oftentimes, or that coaching piece can be so important, because there one needs a mindset that you deserve it, but
sure.
also like knowing why. Why do you want to have sex?
Mm,
And there's a million good reasons. I'm
sure.
not saying that there's a right reason, but really knowing your why makes some of that work that you have to do to achieve what you want to achieve more bearable. I tell people oftentimes to make sex their new hobby. Like, how do you approach your hobbies? You read about them, you buy different tools, you scurry away to like your special hobby room and you tinker away at it for hours at a time.
Have an accountability buddy.
Yes, an accountability buddy, someone to try new things out with.
Uh,
And so when we think about it as like an exciting hobby rather than, ugh, I'm so discouraged that I have to do this, or I'm so upset that things don't work like they used to. And again, all that's valid and needs to be processed. But if you get stuck there instead of moving into, okay, now what?
Yeah.
There's so much opportunity.
Without trivializing what a cancer patient goes to, Jennifer, is it fair to say that our bodies are changing? Like, we're all going through some sort of journey and some sort of acceptance process. And a lot of the things that you mentioned, yes, they're exacerbated and potentially ushered in faster because of the cancer diagnoses. But we've talked about, women in menopause and perimenopause that are they don't have the right tools, resources, information. So we're all sort of, all this to say, again, not to trivialize it, but the more we vocalize it, the more we can come to solutions and tools that
Yeah,
are.
because this is happening to everyone, but no one's talking about it because there is still that shame piece. And I think the more that we do talk about it, the easier it makes to share solutions, to normalize it.
Yeah.
For some people, just knowing they're not alone in it, that alone is so significant
Sure.
in being able to move forward. But the other thing I say to patients all the time is like, all of your friends are going to be coming to you in the next couple of years. Like, there are pieces of this, maybe not in this exact way, maybe not quite so quickly, that are going to happen to everyone.
Yes.
And now you're ahead of the curve because you're already thinking about how to do things differently, what tools to use.
Yeah.
So while, you know, we all wish that this wouldn't have happened and that there was more time, there would be aspects of this that happen. I want to say when we're aging, but really to everyone, like motherhood, stresses at work. Like, we're always navigating how we show up in our bodies depending on what's happening externally. And this is a big thing. It's a huge thing.
Yeah.
But it also can be an opportunity, given that, there's not a choice in whether or not people get a diagnosis.
Yeah, fair enough. And I will say that it's interesting because when we think about prostate cancer, with the men that I know, I'm like, oh man, I wonder how that's going to affect their sex life. And shame on me for doing what I do, I have not, when I think about gynecological cancers in women, I never thought about the breast piece. I had thought about the hormonal piece.
And it's not shame on you. I think it's shame on society. I mean, when we look at the Women's Health Initiative and the damage that that research may or may not have done, when we think
Mhm.
about the medicines and the tools that have been created for people with a penis versus people with a vagina, it's really it is interesting. I'll say interesting. That's a kind word.
You can be
Um,
controversial. This is Kamna Live.
I mean, that's shifting. That's shifting. Like,
Yes, it is.
uh, women are showing up in a way of really like grasping their sexual power, demanding pleasure. There's much less shame. It's still certainly there. Uh, and so I think that things are slowly shifting. And the more we talk about this and the more we create venues for people to talk about it, even the menopause movement. I mean, wow, there have been probably more books published in the last year on menopause than the last 50 years. I'm making that up. That's not a true statistic, but every day I have a new one on my feed.
Yeah.
And in
Not such a
the,
silent passage anymore.
yeah, in the sexual health and cancer space, 10 years ago when I started this, there wasn't a research article published maybe once a year. And now I've got 6 new ones in my inbox every day. And so things are shifting and they're shifting quickly. And I think that that is going to benefit everyone.
Everyone
Um,
agreed, agreed. So what are some of the resources just for people that are listening now? What's something that they can start if we've triggered a thought and motivation in people? What are some of the, 3 to 5 things that they can think about or resources that you really like that they can look at? And I'm happy to link to them in the captions here.
yeah, I mean, one is just being flexible. So being flexible with themselves and how their body works is always one of the things that I think is really important, and being adventurous. Um, and adventurous doesn't mean doing things that you're not comfortable with sexually, but really rewriting what does it mean to have sex? Specific resources, really, ASECT is a great organization to find a sex therapist. Um, there are, I can find a few other things that you can link that are guides that
Love
people
that.
can take to their physician so that they know the right questions to ask, or they can just kind of hand it to their physician if they're feeling a little nervous about bringing it up. There are also certain podcasts. I recommend that people find support groups.
Mm,
Um, but really, it's kind of sitting down and doing some of that work to figuring out
mm.
what's important, why it's important, and then what feels like the most important next step, whether it's reading a book, getting a therapist or coach to help you with that, reaching out to a pelvic floor therapist, kind of like building the plan slowly, but starting to ask some of those questions.
I love it. So I will get that list from you, Jennifer, and put it in the captions below. And I just want to say, like, I'm so moved by how meaningful your work is, just because it's hard enough without having the diagnosis of or the cloud of a disease such as cancer, an ominous disease such as cancer. So in the spirit of desire and pleasure and living the life you really want, I think your work is so, so significant. So thank you for that.
Mhm. It truly is an honor. And I think it's really courageous for people to open up about this topic, and even more so to find their way back to it after a diagnosis like cancer. So it's really a gift to be in this space.
Well, I'm going to go out on a limb on behalf of you and me and say, if you're a cancer survivor and you're having some trouble with this, reach out to Jennifer, reach out to me, and we'll see how we can redirect you and help you. And otherwise, find the time, find the motivation, find the pleasure.
That's right.
Thank you so much, Jennifer.
Yep. Great to be here.